Your eyelids and eyelashes are nasty. In fact, the #1 problem I see with most people's eyes is the fact that they don't wash their eyelids. So in this video, I'm going to break down how bad eyelid hygiene leads to eye diseases like anterior blepharitis and dry eyes. Plus, I'm going to share 5 pro tips on blepharitis treatment at home and how you can clean your eyelids properly. Let's take a look. Hello and what's up, this is Dr. Alan here from the Dr. Eye Health Show, helping you learn all about the eyes, vision, and finding the best vision products. Now, part of my job as an eye doctor is always examining the eyelids, looking for any sort of deformities, irregularities, anything that could be leading to disease. And it's very common for me to see people of all ages, especially at teenage years and older, starting to develop really nasty eyelids and eyelashes. And usually what I see behind a microscope is an extra buildup of skin oils, dead skin cells, and even nasty signs of bacteria and even mites on the eyelashes. Yes, I did say mites in the eyelashes. That is a real thing. And I hate to say it, but ladies who wear a lot of eye makeup, and usually the ones who don't wash off that makeup very well, your eyelids are probably the nastiest. See, when either an ophthalmologist or an optometrist sees this building up on the lashes, we call that having anterior blepharitis. And that's when you have this extra buildup of all this different skin oils and dead skin cells, and then bacteria and these microorganisms, such as Demodex mites, end up eating those oils and dead skin cells, and then they basically cause inflammation in your eyelids and your lashes, and that then contributes to not just pain, burning sensation, irritation, but that also causes an irregularity in your tear film, leading to dry eye disease. In fact, this is such a contributing issue to things like dry eye. I know many dry eye specialists who, for every single one of their patients, they automatically start them on some sort of eyelid cleaning regimen. I once heard the analogy that it was like a nasty swimming pool and people are just adding lubricating artificial tears, like filling up the pool with water, but they never bothered to clean the pool out in the first place. But to be honest, I think part of this issue is eye doctors' faults, that we haven't done a very good job in educating our patients the importance of cleaning their eyelashes and their eyelids on a daily basis. But it kind of makes sense because even if you are washing your face twice a day, most people try to avoid getting soap and water into their eyes because it stings, it burns, it's not fun. But thankfully, now we do have several different safe, easy ways to clean your eyelids that you can just do at home, many of which your doctor will probably recommend to you at some point. So let's break down 5 easy ways you can start cleaning your eyelids at home, preventing blepharitis and dry eyes. Now, all of these treatments are usually available through your local eye doctor's office, so you can always call up your local clinic and ask what they have and what they think may be working best for you. Otherwise, all of these different treatments are available over the counter, and I'll put links in the description below if you want to find them yourself and try them out. #1 is to clean and wash your eyelids and lashes daily with some form of an eyelid cleanser or shampoo. Historically, eye doctors have recommended using something like baby shampoo to clean the eyelids because regular shampoos obviously sting and irritate the eyes, but baby shampoo, the no tear formula, wouldn't cause this problem. However, anecdotally myself, when I would do this in school, I would note that my eyelids would dry out, and in fact it would make them feel worse. And in recent years, many eye doctors and dry eye specialists have been concerned about the preservatives in things like baby shampoo, and is now no longer really recommended because there are studies linking many preservatives found in these products to causing problems with the oil glands of the eyelids and even causing oil gland death, presumably making things like dry eye and blepharitis worse. So instead, it is recommended to look for some other form of eyelid cleansing foam or wash for cleaning the eyelids daily. There are many different brands available for this, most of which do contain a little bit of tea tree oil in it, and that's because it is really good at killing microorganisms, namely Demodex mites. Most of these cleaning products are very safe to use, but you'll notice ones that have higher amounts of tea tree oil may cause more of a burning, stinging sensation. At most local pharmacies, you'll be able to find an eyelid cleansing product like this that's next to all the other eye drops in kind of the eye care aisle. Otherwise, again, there are many companies that make them and are available online. Another great option is that of Eyelid Cleaning Wipes, which are basically the same type of eyelid cleaning products but infused into a moist towelette, which you open up like a little wet wipe and then you clean your eyelids and lashes with that every day. Just like with the eyelid cleansers and foams, there's a lot of different competing products on the market for these, most of which all work the same, except some of them do require you to wash your eyelids with water afterward, while some other products, which I usually prefer, are ones that you can just clean the eyelids and then forget about it. You don't have to wash off your face or anything like that. This one just happens to be one of the newest eyelid wipes on the market that I've been trying out from Tier Restore. They also make a dry eye kind of eyelid mask that I've reviewed in previous videos, but at least with trying this one for the last few weeks, I do find it very refreshing. It doesn't cause any stinging or irritation, and in fact, it leaves my skin feeling very clean and healthy. Again, many different options for cleaning wipes. It's nice usually that you can carry them around if you need to. Otherwise, again, lots of different options. I'll leave links in the description below. Now, to get better results from your eyelid cleaning regimen, you don't just want to get some sort of eyelid cleanser to the lids to wipe away the skin oils, but you also want to agitate the lashes and really massage the oil glands of the eyelid. That's going to result in more oils from the meibomian glands of your eyelids to excrete oils and start to stabilize your tear film. One product that I've reviewed in previous videos and that I do personally use on a daily basis is that of a Nulids device. The Nulids device basically looks like an electronic toothbrush that has an oscillating head to it that cleans and massages the eyelids and the lashes, and also sonically activates the meibomian glands. Coming in at a price of about $250 to $300 US, it may be a little steep for a lot of individuals, but I do find it to be working for myself, and for a lot of my patients, I've had people just tell me that this is the only thing that really brings them relief. I know for some people financially it may just not be the best option, but at least for being an eye doctor and the science behind it and kind of giving us some hope that we can get the meibomian glands to work a little bit better, I think it may be a great option for some people. And at least with some of the pilot studies that they have published, it does show that increased tear breakup time and reduced evaporation of the tears is improved after about 30 days of continuous use. Now, a fourth option for cleaning the eyelids, which looks like an eyelid brush, is that of MyboClean, and maybe an affordable kind of alternative to something like the Nulids device. I don't think they're a direct comparison because the Nulids device really has added benefits of the sonic oscillation, but at least with this, you are cleaning and brushing the eyelids. MyboClean looks like this. They're just little handheld surgical grade silicone eyelid brushes. They're very soft and they're kind of made in an ergonomical design so it really fits along the eyelids and the lashes. But they come in a pack of 4 so that you can use one of these on both eyelids for about 3 months, and then after the 3 months you can toss them out and then get to the next one, kind of like you would be changing out your toothbrush, for example. The whole point is that you add an eyelid cleansing product to the brush and then you massage and clean your eyelids for about 30 seconds or so. In my experience, I have been finding them to be really useful, especially for travel and just cleaning the eyelids really well. Again, I can't make claims that they're as good as something as the Nulids device because I don't really have any data or science to really support that they're activating the meibomian glands, but at least for cleaning the lashes and getting all of that crud and oils away from the eyelids, it does a really good job of that. One thing I really like about MyboClean is their eyelid gel. Again, I've been only trying it for about a month, but it really makes my eyes feel good. It's got a manuka honey, coconut oil, and aloe vera kind of mixture, which with additives like that, it's supposed to help reduce inflammation of your eyelid, which again is the whole kind of issue with blepharitis in the first place. I've been liking this so much, I've been using it for things like my Nulids device on a daily basis. One other eyelid gel I've really liked for myself and using things like the Nulids device is that of Ocular. That is a type of eyelid gel that's designed by an ophthalmologist that has proteoglycans in it. And there's a lot of research into proteoglycans and helping reduce inflammation naturally, as well as helping with pain. And I know a lot of other dry eye specialists who are big supporters of that product. So if you've never heard of MyboClean or Ocular, those are maybe 2 you can check out as well. The final and 5th way of cleaning your eyelids that most eye doctors will probably recommend is that of something called hypochlorous acid. Hypochlorous acid is an antiseptic spray that is safe for your skin. In fact, it's very similar to something like bleach, except that where bleach will cause damage to the surface of your skin, Hypochlorous acid won't. In fact, it was invented as a treatment for diabetic foot ulcers, and then at some point they found that it was really good at cleaning the eyelids in the face. It's used pretty easily just by either spraying it directly to your face or onto a cotton ball and then wiping the eyelashes. Probably the most famous brand in eye care that makes hypochlorous acid is that of Avenova. Avenova originally started off as a prescription-only hypochlorous acid that you had to get through your eye doctor, but since then it has now become over the counter and is something that's just readily available you can purchase yourself. But the whole point to the cleaning solution is that you're cleaning your face and killing any sort of microorganisms that can be contributing to blepharitis and further down the line, dry eye. Since the Avenova product, many other companies are making hypochlorous acid. Sometimes they're cheaper. If you've tried any other different brands, let me know in the comment section if you find one better than the other. I find a lot of these companies will kind of badmouth each other, saying somebody's not fully like 100% pure, somebody else isn't making it the same way, and that it's just not as effective. It's tough for me to really know what's effective or not. I've never seen any studies directly comparing any of these products. But I do know from talking with a lot of biochemists that usually ones that are sold in a glass bottle are more stable and are usually going to last longer on your shelf. This just happens to be the brand I've used in the last few years from the Eyelove company. This is their Hydrate lid and lash cleanser. But again, there are many brands on the market, and you can certainly talk to your local eye doctor what they recommend. Now, of course, these are not the only options for treating blepharitis and for cleaning the eyelids. For people that this really gets out of control, as an eye doctor, we'll often prescribe antibiotics and other cleaning products, even things done in the office to get things really back to ground zero. Please remember that if your eyes are ever really burning, causing pain, you're having disturbance in your vision, do not just consult all of my videos. Make sure that you talk to your local eye doctor about these problems so that you can get properly diagnosed and treated. But I do hope this video helps you out, and if you've learned something new today, go ahead and smash that like button for me, and consider subscribing to the channel if you want to continue learning everything about the eyes and ways to get your eyes just feeling better, seeing better. If you do want to know more about dry eyes and how to treat the eyelids and any issues going on there, go ahead and check out some of our other videos on that same topic. Or if you want to learn something else cool about the eyes here from the Dr. Eye Health channel, click or tap the screen down over here. Thanks again so much for watching. Again, this is Dr. Allen. Keep an eye on it, and we'll talk to you soon.